Good morning. It's an honor and a pleasure to speak to you today. Again, my name is Bobby Awadalla. I'm coming from Laguna Beach, where I have a dermatology practice and a Mohs surgery practice. But I am here today to speak to you about the role of oral supplementation in protection, repair, and beautification of the skin. All right, my only disclosure again is that I created Uvio. It's an oral supplement specifically formulated for the skin, and I am the founder and CEO of the company. So, topical skincare. It is a massive industry. It's estimated that in 2016, global sales will reach $121 billion. And it's no surprise because almost everything that we have available for patient care is topically applied. But what's the big secret? Well, somehow between medical school and our skin professions, we forget that the skin has an amazing blood supply. It brings in nutrients and oxygen into the skin and removes byproducts very efficiently. It actually even has a system to increase blood flow, to dissipate heat, for example, when we're exercising. So, why don't we use this system more often to deliver key nutrients, vitamins, and antioxidants to the skin for skin health? Well, perhaps the evidence hasn't been there or we don't know enough, but I'm here to tell you that there is scientific evidence that shows that oral supplementation improves skin function and quality. Cardiologists recommend omega-3 for heart health. Ophthalmologists recommend AREDS vitamins for patients with macular degeneration. Today, I want to introduce you to supplements that have been shown to have a positive effect on the skin, and perhaps we should use these vitamins and antioxidants and phytonutrients to help our patients from the inside out. So we have evidence that shows that vitamin supplementation can provide sun protection. It can provide repair, both from acute UV damage as well as chronic UV damage. All this leads to anti-aging and beautification of the skin, and also a healthier skin function. The first thing we'll talk about is polypodium leucotomos. This is a fern from Central and South America. It's been used for centuries for skin ailments, and more recently we have started to study it in scientific literature. The first thing that pops out is that taking oral polypodium increases your minimal erythema dose. Studies have shown that on average it can provide increase in MAD by a factor of 3. This translates to an internal SPF of 3 just by taking this supplement. Now that doesn't sound like a lot, but if you convert it to the amount of UV blockage it provides, it's somewhere between 60 and 70% blockage at baseline before you start doing other things to protect your skin. That is incredible. It also decreases reactive oxygen species, which we know are responsible for all these things up above, and we've heard dozens of times. It helps stop DNA damage. It stops isomerization of trans-urocanic acid, which we know causes immunosuppression in the skin, and it decreases apoptotic cells. Further, it's been shown that it inhibits matrix metalloproteinases, essentially increasing the amount of collagen and elastin that remains in the skin. Clinical data for this product show that it actually helps improve actinic keratosis. One study that was done showed that randomized patients after PDT with polypodium versus placebo, that at 6 months, the recurrence rates of actinic keratosis were significantly lower in the polypodium group. For vitiligo, we have 2 very interesting studies. The first was 50 patients on narrowband UVB therapy, randomized to placebo or polypodium. And the polypodium group showed 50% improvement in repigmentation versus the placebo, which was 19. These are significantly these are incredible results for repigmentation and can really help vitiligo patients. Another study showing patients on PUVA, it was about 20 patient study, again randomized, showed that people that were on supplementation had more significant chance of getting more than 50% repigmentation. Again, pretty impressive for firm, natural, plant-based vitamin. Melasma, it's a major problem for physicians to treat, a major frustration for patients as well. And this product was tested for melasma, 12 weeks of melasma treatment with and without supplementation. Randomized trial showed that the supplementation group actually had a 5-point improvement in the melanoma area, melasma area severity index score, whereas the placebo group had no improvement. So again, something you can add to a patient's regimen that is simple and easy to take, and it's natural and good for them. Beta-carotene, lycopene, and lutein have been researched for a long time, and we know that they're very helpful and integral in protecting the skin. In fact, the combination of these three can provide photoprotection. At just 8 milligrams each, we see that there's a significant reduction in the amount of erythema caused by UV radiation. There's also been studies that show it decreases wrinkles and increases elasticity. This study was actually confirmed histologically by showing a 4-fold increase in the pro-collagen immunostaining. So these are very powerful ingredients to use. EGCG, this is the most potent ingredient within the green tea that we consume. And it's been shown to have antioxidant and immunomodulatory effects. This has also been shown to independently provide an increase in MED. So again, providing photoprotection from the inside out. It also reduces oxidative stress, inflammation, and it decreases the pyrimidine dimers found after UVB exposure. So significant in that it protects DNA. On another study, we see that functionally in the skin, it's also having an effect. It's helping inhibit epidermal thickening that's caused by UV radiation. And it's also stopping the increase in transepidermal water loss. So we not only have a more appropriately functioning and appearing epidermis, but it's also more well hydrated. CoQ10 is also very important for the skin. It's been shown to inhibit UV-induced wrinkle formation. It improves the viability of skin flaps in a recent publication in the Annals of Plastic Surgery. So perhaps for the surgeons out there, this is something that you also want to include in their post-surgical care. Nicotinamide has gotten a lot of press lately. A recent article that came out of Australia tested 386 patients, randomized and placebo-controlled. At 12 months, there was a 23% reduction in non-melanoma skin cancer in the supplementation group. That is incredible. They have stopped 1/4 of all non-melanoma skin cancers in this population. In this country, we have 5 million a year. If people just took nicotinamide, do the math. It's more skin cancers than we can all cut out, put together. It also decreased actinic keratoses by 12%. This is also a very significant finding. These results show that supplementation is not only good for protection and repair the function of the skin, but it's actually chemopreventive. This is helping stop skin cancers, which is, for my field, the most incredible finding. Soy isoflavo, very controversial. Some women like it, some women don't, for its estrogen effects. However, for the skin, it has been found to improve fine wrinkles, and it does increase elasticity. Vitamin C and E, we all know, are very important. In combination, they're integral in protecting our lipid membranes from peroxidation and oxidation. So they're integral in our skincare. We've heard about topical preparations, but you can take them orally as well. Independently, vitamin E is very hard to consume, and it's depleted very quickly when exposed to UV damage. And that's why supplementation for vitamin D is very important. Independently, it also protects DNA and decreases apoptotic cells. Vitamin C, independently, is important in proliferation of fibroblasts and is a cofactor for prolyl and hydroxylase for collagen formation. So, two very important vitamins that we must have in our skincare. So, I've gone over just a handful of vitamins, antioxidants, and phytonutrients that are helpful and beneficial to the skin functions and function to protect and repair the skin. However, there's a long list of many more. There's resveratrol, ginkgo, bilberry fruit, citrus bioflavonoids, and many more. And I think we are on the verge of learning more and more about this topic. And we're at the beginning of a revolution in how we think about skin protection and skin care. Without a proper functioning system, I believe that we have a far inferior beginning point. And so if we supply the skin with the right vitamins and antioxidants that it needs from the inside out, then whatever topical preparations will only help boost that. So it's not one or the other, it's that we need to start considering doing both, and that we have this great way to get healthy vitamins and antioxidants into the skin, and we're not really using it to its full potential. I hope I gave some clarity on supplementation for the skin, and that you would consider looking into it as a possible means of helping your patient's skin health. Thank you.
Thank you very much. Great review. Any questions here? Okay, excellent review.